Mind if I move this? This way? Okay. And are we live streaming? Good to go. Thank you. Thank you again for joining us for this latest update of the COVID-19 situation and the city's activities to protect our community. Things continue to evolve quickly, and we want to keep the community up to date, and we appreciate the ongoing support of our local media to help us communicate these important messages. It is very important to us to keep the public informed about the city's response to this rapidly evolving situation. So in addition to our media briefing and release, as I mentioned yesterday, we are planning to hold a virtual town hall tomorrow evening at 7 p.m. We are doing this in collaboration with Cable 14, and it will be streamed live on Cable 14 and via the city's YouTube channel. In order to promote social distancing, the town hall will only be presented virtually. In-person attendance is not available for residents or media. You can submit your questions via Twitter, tag the City of Hamilton, or via the city's website at www.hamilton.ca/askcovidquestions. And we will do our best to answer as many questions as we can. I also wanted to mention that the City of Hamilton is working with 3 local Chambers of Commerce partners to develop an approach to business continuity and economic recovery. This will help position us for a full recovery following the end of the COVID outbreak. They will be launching a website this week and will provide the business community with some more supports and information, so stay tuned. And with that, we've invited you here today to share updates from public health and some additional actions that the city is taking during this COVID-19 pandemic. We all recognize fully, this is a particularly challenging time for everyone, and that these changes have widespread impacts on all of you. However, I can assure you they are absolutely necessary to help reduce the risk of COVID-19 virus spreading in our community. And so now I turn it over to Paul Johnson to provide an update on some of the additional changes the city is recommending. Paul?
Thanks, Mr. Mayor, and good afternoon, everybody. As you all know by now, last night we took the decision to close all city facilities to the public. This was made following the announcement by the Provincial Chief Medical Officer of Health late yesterday. Our team met into the evening and decided that it was prudent to close this morning, so none of our facilities open to the public this morning. This closure includes all municipal service centers, public counters, City Hall. I know some people have talked about it. Yes, the community recycling centers at this stage are closed, those types of things. We are working through how we will be able to potentially deliver some services differently in the future, but we felt it was prudent to close all of our public-facing services so we could take stock of how to deliver them differently and whether we'll be able to deliver them. All our closed facilities at this stage are until April 6th, 2020. So you'll notice that's the same time frame as the previous closures of our recreation facilities and libraries. I'm going to ask the public to please bear with us as we continue to work through scaling back of some services and determining how best to deliver services going forward. The reality is we have never had this large a scale shutdown of services and redistribution of services. We're not talking about a day through a snow event or something like that, or a couple of days. A power failure of a number of years ago comes to mind. This is something that's going to be in place for at least a couple of weeks, and so we need to find ways to deliver important services to the community and do it in different ways. You will need to bear with us. We're not going to be able to do that in very short order. I do want to assure the public that essential services that we rely on as Hamiltonians each and every day continue to operate and are unaffected. If you need to dial 911, you will receive service as quick as possible. Our water system, our transit system continue to operate. And our long-term care facilities continue to provide excellent care to the residents who call them home. I want to thank all of our staff who arrived at work today to closed facilities and have throughout the day been receiving assignments about how we can get them home as per the recommendations of the province's Chief Medical Officer of Health, and certainly backed up by our own local Medical Officer of Health, Dr. Richardson. We want to make sure that our staff are safe, and through the day, we've been releasing people to home to work. We've been figuring out how to deliver services in the short term, and as I say, we will continue to work on how to deliver services in the long term. As I mentioned yesterday, many of our city services are already online. You do not need to attend in person to do much of the business with the City of Hamilton. So I'd encourage residents to visit the city's website, and there we have a list of all of the services that are currently online, ready to go today, so that you can keep doing business with us. We also continue to have our call center fully staffed up, and so if you have questions, 546 City is always there, and we'll get back to you as soon as we can with how you can do business with us. Elizabeth will give some more information, but you will also note that effective immediately, all Hamilton bars, restaurants, theaters, and nightclubs have been ordered to close, and that aligns with the announcements by the Premier early this morning, and certainly the strong encouragement by the province's Chief Medical Officer of Health late yesterday. Yesterday we talked about HSR in transit, and a reminder that as of next Monday, we are moving to a Saturday level of service Monday to Saturday and Sunday service on Sundays. We also know that that has created some concern for residents, but as I mentioned yesterday, this is about providing a predictable and reliable transit service. We have seen a tremendous drop in the amount of people using our transit system. We will continue to provide this transit system, however, for those who need it. One other change for HSR is effective immediately. HSR has blocked off the seats immediately behind the operator of our buses, the drivers, and we have moved the yellow line in an effort to increase the social distancing and the safety for our transit operators. Additionally, all persons with mobility devices will be loaded and offloaded through the front door. This will allow them to access the bus, but will limit the amount that the driver has to walk through the bus and the number of times they have to walk through the bus to get to the rear door. So that change does not bar people from accessing transit. It's just a change to further protect our drivers. I do have some information today about how we will further support our shelter system and those experiencing homelessness. The City of Hamilton has identified 3 sites that will operate as an isolation site for shelter residents and homeless and street-involved individuals who are experiencing symptoms of COVID-19. There are 3 different sites so that we can serve different demographic segments of our community: men, women, and children, and families. Each site will provide emergency shelter and essential provisions for individuals and families that have been assessed and require isolation. These are not regular shelters. They will not provide regular shelter services, and individuals experiencing homelessness and requiring shelter are asked to continue to approach the shelter system as normal. We're working with our shelter providers and healthcare providers to understand how to best assess individuals who are homeless and require that isolation and require further health supports. And I've been really, really impressed by the way that our agencies have come together, and also some groups such as the Shelter Health Network who are offering their expertise to help us provide the best care to those who are extremely vulnerable. In addition to the 3 shelter sites that will be opened up for isolation, we have ensured that there are drop-in programs available for homeless or street-involved individuals in this community. Wesley Center recently announced that they will continue to operate at least through to the end of June at their location at 195 Ferguson Avenue North. Today, I authorized the extension of Willows Place and Carol Ann's Place for an additional month to the end of April, and we will again reassess it in April so that for women, there are drop-in programs available. And we have been in contact with Living Rock Ministries, who provide drop-in programming for young people. These centers will have a priority placed on access to hygiene, toilets, and showers so that individuals who require those services have places to go, even if they're not in the shelter system. So we are focused very much on ensuring that all residents of this community are safe And today, I'm pleased that we've been able to take a step forward in terms of our vulnerable populations. In terms of the new sites for isolation of shelter residents, we expect those to be fully operational by the end of the day tomorrow. The Mayor did mention the virtual town hall, so I won't repeat that piece for you. I will say that our team is working incredibly hard to make sure that we have good continuity of service at the City of Hamilton. We expect that we will find creative ways to deliver many of the important services that Hamiltonians and the people that do business in Hamilton rely on. Just bear with us as we take a couple of days to sort out how that will happen. I'll now turn it over to Elizabeth for an update from Public Health Services.
Thanks, Paul. So I'm going to update about the cases at this point, as well as talk a little bit more about the bars and restaurants, and then again talk about social distancing. So today, we, as of this morning, had 15 confirmed cases of COVID-19 in our community. Overall, we have 6 of those people being over 60 years of age. 5 of them have had cruise ship travel, and all but 1 had other travel history or connection to travel. We did overnight have our first case that we cannot find any travel history for, and so we are calling this our first community transmission. We are not going to speak to individual cases on a go-forward basis. We're rather, just as I've just done, speak to trends as we go forward and look at numbers as of 9 o'clock each morning. I would point out for you that of the 15 confirmed cases, for at least some of them, there is a family connection. And the reason why I'm raising this is that when we're talking about social distancing, we need to talk about that in many ways. One is between people at work and people out in the community, but we also need to be thinking about that within our own families, especially if we have somebody who's ill. So on that note, as the social distancing part is very important, we know that we really have an opportunity here to slow down the spread of this virus, and just how critical that is in terms of reducing the overall number of people who are ill, but also in ensuring that we have healthcare resources available for those who might become more severely affected. A reminder that for the majority of us, this would be a mild illness, similar to the cold or flu. But for some, it is more severe, particularly those who are over the age of 60 or 70 and those who have multiple chronic illnesses. So we are definitely doing this to protect our own health, but we're also doing it to protect the health of our friends, our neighbors, our parents, our children, the people in our community who are vulnerable and need our help to protect them. We're doing it so that we can have those healthcare resources available to them should they need them. So what does social distancing look like? Telecommuting, you've heard Paul talk today about many of our staff are working from home and looking at ways we can increase that. We certainly know that people need to continue to work. You've heard today how important it is. This is not a general shutdown, but that we do need to continue to have people work, especially amongst our essential services. So things like virtual meetings are important. Avoiding non-essential trips in the community is important. If you do have to go downtown and take a taxi or an Uber, to leave your windows open while you do that. Limit or cancel any group meetings, and of course you heard that any group gathering over 50 people is ordered not to occur. Maintaining a 1 to 2 meter or 3 to 6 foot distance from others. And we need to think about the things we can still do in this kind of environment. So what can you do while we're talking about this social distancing? Well, you absolutely can go outside and take a walk, go for a hike, take your dog out. If you need groceries, do go to the store. Try to go to the store in off-peak times. Try when you're out at the store to maintain that 3 to 6 foot distance from others that are there. In terms of the bars, restaurants, nightclubs, we heard from the Chief Medical Officer of Health yesterday that he was recommending closure of all of those, along with daycare facilities and private schools. And today we heard of the Premier declaring the emergency and the order to shut these down. So today, my colleagues who are public health inspectors and municipal bylaw enforcement officers have been out with restaurants and nightclubs to reinforce that message, to make sure that is happening. And we will have staff on tonight, another 10 public health inspectors and bylaw enforcement officers out tonight to make sure that that happens. These closures are expected to remain in place for at least 2 weeks. And now, while these are closures to the public in terms of seating, we are very much encouraging, as much as possible, that takeout facilities and these restaurants that can convert to doing takeout or delivery continue to do so to help to support food service in our community. I really want to underscore that, by and large, as the Premier said this morning, people do the right thing, and we definitely found that when we've been out there today. Most people had already voluntarily closed, and we definitely saw people, when we made them aware, if they had not already been aware, that they were quick to say they would come into compliance. With today being St. Patrick's Day, we know this is a day we love to celebrate our Irish roots for many of us, but it is very important that we all look at doing that celebration at home, in moderation, I might add, rather than looking to congregate, whether it's with friends or in impromptu sort of street parties or that sort of thing. Practicing social distancing is very important, as I've said. The other message is just about our what sort of information sources are available to us. So we do have, you've heard from Paul, a number of websites. Again, we have www.hamilton.ca/coronavirus. There you're going to be reminded of the things you can personally do. Wash your hands. Don't touch your eyes. Don't touch your face. Avoid contact with people who are ill. Remember that you don't need to have alcohol sanitizer. Good old soap and water is sufficient, so don't worry if you haven't been able to pick some up in the store. Make sure you're using that. When you're greeting others, don't shake hands, try a wave, bump elbows, some other way of doing it. And maintaining a healthy lifestyle is very important. We know how stressful that these things can be for people as they're going through. It's very natural to feel stressed about this. It's very natural to feel anxious. All of us are probably feeling very similar things. But please remember there are things that you can do. You can get out for a walk, you can eat well, you can try to sleep well. Those are very important for your health, for your resilience, for your body, and most importantly too, for your mind. So please remember those things. Finally, if you do feel you need further information and to speak to somebody about COVID, you can call the PHS COVID-19 hotline, which is 905-974-9848. So that line is there for you. We do ask people who are feeling well, they're more than welcome to call that. But if you're looking for an assessment center visit, you're looking to be tested, there's not going to be testing of people who are feeling well, so please do stay home. There is a self-assessment resource that is available on the ontario.ca website, and please go through that, look at that, see if you need to be thinking about an assessment center. We do know that for the visits that were made last night, by far the majority really did not need to go to the center. They were people who had traveled but were well, or they were people that were worried. Please stay home, call the resources that are there, go through that self-assessment, because there are people that definitely do need those assessment centers, and we want to make sure that they are available to those individuals. Thanks very much.
So thank you, Dr. Richardson and Paul Johnson. These folks have been working day and night to make the difficult calls and choices that have to be made, and I compliment them and the EOC team for all the great work you've been doing. Someone has to make these difficult calls, as difficult as they are. I hope that the public will understand that these are necessary and will be important for us as we try to flatten the curve, as they say, on this coronavirus. Major retailers have assured us, I'll say again, that there is no shortage of food, groceries, or toiletries in the country. Even though some of the shelves might be empty in some locations, restocking is happening, the supply chain is functioning. There is no reason to take more than you need, so leave some for others. It's a very important issue. We all need to have resources to get through our lives at this point. So the more that you take, the less there will be for others. So please be mindful of that, and be assured that the grocery stores and drugstores are going to remain open during these closures. And so you'll be able to get what you need when you need it going forward. I'd like to thank the public health teams, the caregivers, the call center people that are taking an enormous amount of calls and are working virtually day and night as well to answer some of your questions. And we look forward to the town hall coming up tomorrow. I can also tell you that your mayor and council will be meeting right here this coming Friday at 9:30. In fact, the room is spatially set up for that meeting already to ensure safe separation and to deal with some of the important issues that we need to deal with, not the least of which is the budget. and some delegated authority matters that will help our staff continue to do the good work that they need to do to keep our city functioning. And again, hamilton.ca coronavirus for more information. Public health hotline is 546-2424-7970 is the extension. A lot of information is available on those sites, and we encourage you to visit them as often as possible or as necessary, and to continue to look after one another out there. You know, as the doctor said, 80% of us are going to be fine. We are actually avoiding contact with one another so we can protect the 20% of us that are vulnerable in these circumstances. So if we all do our part, we will get through this together. And on that note, any additional questions from our media?
Hi, Paul. Can you talk to us a little bit more about what's being done for our homeless population and the sites that are being set up? So are they all in the lower city, for example? Can you give us the locations of those, or how much room you have?
So they are all recreation facilities. They are all in the lower city. They're not shelter facilities. So at this stage, I'd like to keep it at that stage for us because A, I want to get them set up tomorrow, make sure they're actually operationally feasible. B, we're not going to be publicizing the addresses of them because these are referral-only sites. We will work with transportation with the shelter system. If you are homeless, if you are experiencing homeless, if you encounter someone who is experiencing homelessness, they need to first go to our existing emergency shelter system. These are being set up to support the shelter system. We've had 2 meetings with them in the last 2 days. And in both cases, they've said they are significantly constrained in terms of their ability to isolate people within the shelters. And obviously, we want to make sure that our emergency shelter system is there for those who are well and continue to provide services to those who are homeless. But I can confirm they are all right now proposed recreation facilities, and they are all in the lower city.
But you said that, how are we splitting these up again? Is there one facility for
One
men?
of the facilities will be for men, one of the facilities will be for women, and one of the facilities will be for families. The women's facilities will be set up to also accommodate women with children.
Dr. Richardson, can you talk a little bit about what it means now that COVID-19 is in the community? Can you talk a bit about the significance of that and what that means and what that changes?
Sure, absolutely. So community spread is what we've been looking for, and this is where we can no longer connect back the cases to somebody who's traveled from another country, another affected area, or who's been in contact with a known case that we knew about already. And so what it indicates is that it is out in the community and that we can't find those contacts. It doesn't mean, of course, if we could spend all the time and resources, we would be able to contact it or trace it back. But we aren't able to do that fairly easily with the resources we have. So this is an indication that, you know, while we're going to continue to try and contain this virus and try and limit its spread, we are, you know, concerned that we're moving to that next phase in terms of where it's at. This is why the social distancing measures are so very important. We heard from Toronto yesterday as well that they felt they had reached that point. And so, you know, that's why we're seeing this step up in terms of really requiring the social distancing, closing down the sorts of facilities that have been talked about in order to make sure that happens, and really underscoring the importance that each and every one of us needs to take in order to do that. What we're trying to do, again, is with that curve, it either goes up quickly and we overwhelm the healthcare system, or we try and flatten that out, try and reduce the number of people overall who become ill, protect the people who are most at risk of becoming very ill, and spread that out.
Dr. Richardson, are you concerned about the rate at which, I mean, it's only been a couple days and we already have our first sign of a non-travel related case. How concerning is that to you? And do you feel that we're going to see more cases rise at an exponential rate?
So those are, you know, the concerns that we absolutely have, is just how fast will this increase? And what we know is when we've seen it where they have not used control measures, that's what's happened, is you've had that very quick rise. What we're trying to do is blunt that curve and have the rise be less quick and slow things down. So absolutely concerned about having more cases. We want to see that curve be flatter in comparison to other areas, but those are the concerns that we have, and we're going to keep monitoring for it. In terms of, are we surprised at the rate that they're going up? Not at this point in terms of we think we're already well on the way. We definitely think that the measures we're asking people to take can make a difference, and that's why they're so very important to underscore. But we're going to keep monitoring it and keep riding along with this and trying to change its trajectory.
Hamilton has appeared to have a lot of cases in the last, just 2 days, like 10 in the last 2 days. Is that because it's spreading quickly, or is that because it's all mostly in one family or from one cruise ship? Like, is there something here that sort of caused that spike, or does that mean that we are, rising at a pretty fast rate here?
That's a great question. What we've known up till now is that a lot of this is travel related. So with the information that was going out to come home, we're not surprised that those travelers have come home and some of them have been infected rather than have been found while they were abroad. We are seeing, as I told you, we have 6 or 5 cases that are associated with cruise ships, so that's definitely accounting for a number of our cases. We have had some transmission within a family, so again, that's accounting for some of it. So for me, that's a bit of good news, if you could have any in this in some ways, because we know that that's where they've come from, but definitely this first case that happened overnight last night, where we can't trace it back, and our staff do pretty extensive contact tracing no matter what. That's the concern, is that we're entering some new phase in this this illness.
And what's the rationale for not describing specific cases?
So for us, you can imagine for us the amount of work that our staff are doing. We estimate we have 50% of our staff redeployed to this effort at this point. That means there's over 200 public health staff in addition to our usual sort of 15, 20 people who work on this on a daily basis. And so for us, trying to get in the information, get it collated, get the things worked out, having specific information each day is not useful for anybody. But to have trend information about what's going on and look at it in the aggregate is definitely important. We also want to be very mindful of the privacy of these individuals. The province in its early stages with this, they need it, and they've talked to the families. We've talked to families about what we're going to say in terms of these cases, and they have been fantastic about it. They know that people want information. They understand that it's important to be out there. But we do need to get back to respecting people's privacy. And so we're happy to provide that information in the aggregate. That's really where it's more meaningful, ultimately anyway, rather than at the individual level.
Is there anything you can do to make sure that the people who are coming back do self-isolate? Because we're hearing from people saying that, they know their coworker came back from Mexico yesterday and today is now sitting beside them at work. Is there anything you are doing or can do to try and get those people to self-isolate?
Really what we're doing in terms of the travelers is having that follow-up, really with them on a broader basis in terms of the communication, right? It's happening at the airports. My brother returned from Mexico for work, where he'd been for work. He got that information. We know it's out there. So there's information from multiple sources. It's definitely the moral suasion piece, right, where we're all asking people to do the right thing, and most people will do that. Where there are contacts of cases, that's where we would then sort of step in more so. And of course, we are talking with them to say you need to isolate, and we check in on them regularly to make sure that's the case.
Do we have any trend info about these 5 new cases? I know that you kind of talked about trends of the overall 15, but is there anything you can tell us about these new 5 trend-wise?
I don't have anything specific. At least one of them is another cruise-related case, but I can't tell you anything more in terms of specifics.
Speaking of moral suasion, do you have a particular message for to the airlines that continue to send? I mean, we still have sunny destination trips. Looks like they're on target to leave Hamilton Airport over the next 2, 3, 4 days. Are you sending a message to the airport or having discussions with anyone about those opportunities?
So really everything about travel happens at the federal level when it comes to international travel. And so I know my colleagues at the Public Health Agency of Canada are definitely having those conversations. That's why you'll see level 3 travel advisory that all non-essential travel is not recommended at this point. And I do think we do see with several of the airlines that they are also changing their operations to respond to that.
Is the city considering going into a state of emergency, and would that change anything at all? If so, because the province is already in a state of emergency, right?
So declaring a state of emergency locally is something that we looked at. It's important to note that the City of Hamilton has done a lot of the important things by setting policy in terms of our Emergency Operations Center. We have pandemic planning documents that have been brought to councils in the past. So at this stage, we've reviewed it and looked at it. We don't believe that there's an imminent reason to do that. What might change that is in the future if we had difficulty accessing resourcing or if we had some civil unrest situations, those would be cases where we need to go. But the reality is that the City of Hamilton, rather than rely on those kinds of declarations of emergencies to take this on, we actually have a structure in place. So to be fair, it meant we didn't have to wait to have a council meeting to declare something to execute on our Emergency Operations Center and get started. It was felt quite a while ago that delay time could actually cost us the ability to get things happening. So what you see is the majority of things you would want to have happen in the early part of an emergency is already something that we have delegated authority to do, and you've been hearing about that. It's why these announcements come out from the Emergency Operations Center, and we don't wait for that declaration to happen. So it could change in the future. There's no question about it, and we would work, the head of council, our mayor, is the only person that can declare that. So we would work with the mayor on that, but we've reviewed it with our legal services at the moment. We don't feel there's a necessity.
Are you able to say, Paul, how many, just in talking to the HSR, for example, you're preparing for the prospect of many drivers self-isolating or having to self-isolate. How about just corporation-wide? Do you know how many employees are sort of out of commission for a couple weeks?
So no, because across the corporation, I mean, we don't track where people are going. So we know there's a lot of people off on vacation, so we're trying to get a sense of that to look for future planning. This is a big week for us as they return from March break. But I mean, under normal course of business, we don't across 8,000 employees, we don't check in and say, hey, where are you going for March break? So we have some anecdotal evidence, so we have sections. And Debbie in transit was able to predict some, but even in that, it's a range. People thought they were going to the U.S. or overseas, but don't know. Our big question will be how many when they return. We've been very clear. Our policy is very clear at the City of Hamilton. They will self-isolate for 14 days. So when we come back, supervisors will be checking in and seeing that, but I can't give you a range.
But you're not anticipating, being short paramedics or even garbage pickup collecting personnel or?
So at this stage, we know there will be some impact in that area, but not enough to affect operations. I've talked to both of our chiefs, and they're undertaking efforts to ensure that they can continue their operations. And in all the other areas, no, at this stage, we're not anticipating that. We are having to work more heavily on the side of how do we support our staff, given the fact that childcare centers are closed, schools are closed for an additional 2 weeks. To be honest, that's a bigger operational challenge. We have far more employees who have children that are school age than employees who this week or last week were away overseas.
What kind of response have the bylaw officers been getting when they've been going to restaurants? Have the restaurants still been open? Have they been happy to close? Have they been pretty grouchy about it? Like, what kind of a response are they getting when they go?
Yeah, it's the public health inspectors and the bylaw enforcement officers who went out together today, just to make sure that the message was getting driven home. And as I was saying earlier, as in all things, we find most people, they go out and do the right thing, and we certainly found this in this instance. Many businesses had already made the decision to close based on the information that was out there, and I'm sure based on their own business economics as well. And so by far the majority of them were either already closed or were happy to get the information and understand what they needed to do next. It was absolutely a tiny number who were not willing to do that or were concerned and wanting to understand why, but we still have every confidence that they will go ahead and comply. I think it's pretty clear, it's pretty serious with when we've got the Premier talking about his order, we're talking about the Health Protection and Promotion Act being used, those sorts of things. We will, though, go out tonight, as I said, to make sure that those sorts of things are happening.
Are you targeting certain areas right now? Like, are you starting at certain areas with the bylaw and the public health?
So as is usual for our work, we like to show up unannounced.
Just to be clear, how many city workers are, or city staff are working from home, and how many are in self-isolation?
So the number in self-isolation I don't have, and in terms of who will be working from home, our default position is we have to understand from our supervisors and the managers why they can't work from home. So we will have as few people as possible in our offices. We take the advice from the provincial health folks as well as Dr. Richardson very seriously. So today's exercise has been how many do we absolutely need to have in offices? Because the other thing that will occur in offices is we will look at redesigning space or separating people in different ways so that if they are in the office, which are safe, our buildings are not inherently unsafe, we simply need to make sure that that separation is there. So by having fewer people in the office, those who are required to be here, an example I'll use that came this morning, we actually have to physically generate some checks in Ontario Works, and we can only do that on site. And so we will have to have some people at an Ontario Works office actually physically creating those checks so that people have an income. We will ensure that proper cleaning is being done twice a day by our cleaning staff, and that the distancing of those desks, if they're too close now, they will work at another desk, or they will have a separation factor for it. So I'll have better a sense of that as the days go forward. Today, as you can imagine, everybody arrived. We're working through that plan, and by the end of today, we're going to have the first wave of that through. So I would say by the end of the week, I'll know for sure for the next couple of weeks the kind of percentage of staff that are actually working in any offices. But I want to reiterate, and I know our staff are very concerned about it. If there's a question we've been receiving over and over again, it's, why do any of us have to be here? And our answer back is our default position is we want people in their homes, not at work, but if they have to, there will be an absolute reason why they need to be here. It's not a case of, well, it's nice to be here, so we'll let you be here.
And to be clear, why doesn't the city know how many of its own staff members are in self-isolation?
To be honest, there are so many things going on. That's not a number that we're tracking in terms of the Emergency Operations Center. Individual supervisors and staff people may know that, but to be honest, for my decision making, it doesn't make any difference from an EOC perspective.
Do you know how many people, Dr. Richardson, have been to the assessment centers? You talked a little bit about how you're getting some of those worried well. Do you know around what percentage that was?
I'm sorry, Joanna, I don't have the numbers with me from last night. I know the group has been meeting and looking and reevaluating things over the course of today. But I do know that was a significant portion of them. And so again, just reinforcing that message about, you can't go there and just get a test because you want to see, if you're negative, if you're well. That's of no value for anybody, and the supplies for testing are very limited, and we need to preserve those supplies for people who are sick. We also use personal protective equipment with each patient as we're going to see them, because we assume they're coming because they are sick, and so those supplies again are limited. And so it's really important that we're using those and preserving those for the people who really need them, the people who are not well, the people who have that travel history or have a connection to a case, or go through that self-screening process and see that they really should show up to an assessment center, go through, call, get booked in, and then we will see them.
All right, thank you all very much. We're going to wrap it up at this point, and we encourage everyone to continue to be vigilant, wash your hands, make sure you're looking after your fellow citizens, your neighbors, those that are at risk, and if we work together, we will get through this together as well. Thank you all very much, and don't forget about the town hall tomorrow at 7 p.m. Dial in, and we can hopefully get to some of your questions. Thank you.